Hey y'all, and welcome to my channel. On this page, I talk about technology and money, and then also trending topics, sometimes other topics as well. If you're new here, you're welcome here. I'm glad either the algorithm brought you here, or perhaps someone shared my channel with you. If you're returning, welcome back. I do ask if you find this content interesting, engaging, and helpful, if you could please like the video, and then also share it. Because share what that does, liking the video, excuse me, and sharing it is you telling the algorithm you find this information helpful. And then it also encourages me to continue creating content that you all find interesting and helpful, timely, and engaging. So today I wanted to share this article that came out on CNBC this morning about how a hospital, really a health system down in South Florida, are using artificial intelligence to fight doctor burnout. So they also mention nurses, because I am a nurse, and when I see these type of media, I always look to see if the use cases that are being applied for physicians can also be applied to nursing, and it certainly can. Now, this facility talks about it for physicians, and the reason why I continue to talk about artificial intelligence and such as generative AI, like your OpenAI, the GPT-4s, and other platforms. GPT-4 is not the only generative AI product out there. There are definitely others. But the reason why I continue to talk about it, but also predictive analytics, predictive AI, which is not quite the same as generative AI, is because like I've been a nurse working in tech, informatics, as an informatics nurse for 20 years. Actually, this is my 20th year. I have never seen a technology evolve so rapidly and be embraced and engaged and integrated as is what's happening right now with generative AI. It is happening very fast. I've never seen the technology spread and be utilized as fast as this. So if you missed it last week, I did a book review. I did a review of a book I recently read about 2 weeks ago on the AI revolution in healthcare, GPT-4 and beyond. If you haven't seen it, I'll try to link it below if you have not seen that video. But even that book came out in April. And the authors of that book, which like were a physician, a data scientist, and one or two others, acknowledge like by the time the book is published and released, some of the information in it will be outdated because it's just evolving that rapidly. These large language models, these LLMs, are progressing so rapidly that information is changing on a very regular basis. So this hospital in Jacksonville, Florida, they're leveraging, looking at ways to leverage artificial intelligence to cut down on administrative tasks, which contribute to burnout for nurses and doctors. And I think I talked about it here before, but if you just even if you go to the American Nurses Association or you Google nurse burnout or the burden of nursing documentation, there's a lot of peer-reviewed and validated data out there that the burden of clinical documentation on nurses and also physicians, but on nurses really does impact their it impacts their overall health. It impacts the time they feel like they have to spend with their patients. And it just adds on to the additional tasks that they're already doing. So at this hospital, they're using an app from Microsoft called Nuance to transcribe and document patient visits. So anytime a patient, you go see your doctor, the physicians, the doctors, or even an advanced practitioner such as a nurse practitioner or physician assistant, they have to document that visit because that's all part of like your patient care, your patient clinical history, and also is tied to like insurance reimbursement. And so in this article, they talk about Dr. Trachella Johnson Foy. When she meets her patients, she pulls out her phone and asks them for permission to record the appointment, and she lets the patients know she's a family physician. So that means she works in, sounds like she works in primary care. So they're using the DAX app. And what the AI program does is it transcribes what the doctor says and what the patient says, and then it automatically generates a clinical physician summary formatted for the electronic health record. Y'all, that is so major because, you can have someone transcribe for you, but they may not be a physician, right? I mean, they're definitely experienced transcriptionists. I recall the days, in my early nursing days, where you have physicians, they would have their transcriptionists go with them to clinic, and it would essentially be another person standing in the room listening to the patient provider interaction and taking notes for the physician to help them out. And then I remember when doctors and advanced practitioners were talking to handheld microphones, handheld recorders, and then there would be someone who would actually type the notes out for them later, right? I remember that. I remember those days. And then also, I know there was a software. Just like Nuance or Call Dragon, which I believe was also owned by Nuance, where the physician would talk into the app and it would type while the physician is talking. But in this case, the AI is capturing both what the physician says and the patient says, and it's freeing up doctors from having to type up notes during patient visits and finish them after they get off shift, which is called pajama time. So using AI to do this alleviates that pajama time and help doctors and nurses fight burnout. They talk about the economies of scale, and then also this right here, eliminating administrative redundancy and bureaucracy overhead, and of course allowing people to work at the top of their licenses. But that reduction in administrative redundancy, that's a lot what I've seen people talking about around ensuring that you're upskilling yourself, digital upskilling, and you're preparing yourself, especially if you're in a behind the scenes back end type of administrative role that would normally do this type of work, like documented visits, requesting insurance pre-auth, authorization for procedures, processing bills. And this article acknowledges that accounts for about 25% of healthcare costs. And then so researchers have looked at and said, okay, adopting generative AI to simplify those tasks could help hospitals, health systems cut their total costs by 5% to 11% in the next 5 years, and allow physician groups to achieve up to 8% savings, and health insurance companies up to 10%. That's not insignificant, okay? A 10% return is return is quite healthy. But they do acknowledge that implementing these technologies may not be cheap, right? Because you do have the cost of implementation, you have the cost of validating, you have, you may have to have an engineer do the prompt engineering, et cetera, and the testing. And then they just talk about how health systems working with new generative AI programs to automate administrative tasks. They still require a doctor or nurse to check over the automated documents before they're included or saved in the medical record, right? You always, and that, that's no different than what nurses do all the time. Like when you have pumps that are pre-programmed for your drips or your medication delivery, even if the pump is pre-programmed or the medication comes from the pharmacy with your drip, where your automated drip rate already calculated on the medication for you, always want to validate. That's no different, right? That would be no different than what we already do. Or even when you have electronic medication administrative records, or MARs, you always want to check your MAR against the original doctor order to ensure that you are administering the right dose to the right patient, the right times, etc. And then they talk about in this article how this former FDA commissioner talks about how generative AI could eventually eliminate some doctors' jobs by creating, quote, large language models that operate fully automated, parsing the entirety of a patient's medical record to diagnose conditions and prescribe treatments directly to the patient without a physician in the loop, end quote. And I don't believe it could totally eliminate, because you still have to have a human being to validate, right? So perhaps that person could be upskilled and put in a different type of role. And they talked about the different ways that this type of technology could be used not in a good way, or not used responsibly. And this is something I did not know, that there were two major health insurers that were sued over the use of conventional computer algorithms to deny medical claims. And that I had not heard. That's really interesting, right? And then it goes on to talk a little bit more about generative AI and other companies, which I believe I've talked about some here, like Amazon and Google, that have also launched or are launching generative AI products for healthcare. So yes, y'all, that's it. I just wanted to do a quick live on this article and share it with you, right? Because there's so much happening so fast. I mentioned it before, but in case you missed it, the Alliance for Nursing Informatics, that's the organization that releases the Journal of Computer Informatics and Nursing. They are doing a very special edition on artificial intelligence in nursing. That's going to be released this spring. All right, they just started the call for papers about 2 or 3 weeks ago. The HIMSS, the Health Information Management Society, they're doing a special task force to talk about AI and healthcare with nurses. Coffee with them, that's coming up later this month. So there's a lot happening, y'all, very fast. So as I come across these things, I will continue to share them in the references to get y'all thinking, right? Thinking about use cases, no matter where you may practice, whether you're at the bedside, you're in the operating room, you may be in a physician's office, like in an ambulatory setting, or you may be in home care and hospice, right? Different use cases for how artificial intelligence how it can be utilized to help you do your job better. All right, y'all, that's it. I hope everyone has a good day. Thank you for tuning in. Please do like the video and share it if you made it this far. Thank you so much for your support, and I'll see you in the next video.